A community health survey is underway right now in Mahoning, Columbiana, and Trumbull counties to learn which resources are most needed locally. The online assessment takes 15 minutes and it's linked over on the 21 News app and WFMJ.com right now. Mahoning County Public Health Commissioner Ryan Tekac is joining us to share more information about what they're gathering, how they'll potentially use the feedback. Thank you for joining us.
Thank you for having me.
Yes, so you're teaming up with other health departments and Mercy Health on this survey. Ryan, what are the main topics that you're hoping to learn more about?
Yeah, so community health assessments are not new. It's something that's actually done every 3 years where the health departments, they take the lead on it, and it's working with our community partners, such as Mercy Health and both mental health boards in Mahoning and Trumbull County, and an organization called Healthy Community Partnerships. And what it is, the reason why we do it is we are surveying the community, and we want to know from the community, what are their health needs? What's the most important factors that our community sees today that they want our partners to work on? And it's data driven. So as you take this survey, we work with a consultant, and the consultant that's working with Mercy Health right now is Moxley Public Health. And they analyze this data, and then the data is given back to our partners. We take it back to the community, and then we want to know, what is it? What are the topics that you would like for us to work on the next 3 years to improve the health of Mahoning County?
And what were the topics from the last 3 years? Do you think any changes will happen?
So the topics that the three main topics that came out from the last health assessment was mental health and substance use, community safety, and access to care. And it's something that we were not surprised at 3 years ago. And we want to be surprised if it's those topics continue to show within this assessment, or you may see some new ones that come up, or what we go back to a previous health assessment that might be maternal and child health related. We know that in Mahoning County and Youngstown, we have a infant mortality issue and a disparity in Black infant mortality. So there is the potential for us to revisit and see that as a priority topic that the community wants us to work on.
Now, you put out this assessment in mid-December, right before the holidays. How's it going so far? And, what's your message to encourage people to participate?
So right now, when we're working with the consultant, they give us some feedback on if we meet our goal, which we have met our goal for the data that is needed. But of course, the more data that we receive, the better off that we are when we analyze it. So I know Trumbull County is doing a little bit better than Mahoning County. So my message to our community is, please jump on the website, whether it's Mahoning County Public Health, our social media page, or the link that you'll find here on the news station, and participate. Like you stated, it's only 15 minutes. It's a very simple survey, and we would appreciate the community if they would participate, because we use this information and we gather this information to ensure that we can make Mahoning County better.
And it's anonymous. You don't have to give your name or your address or anything.
100% anonymous. It does gather some demographic data, and then it gets into some data that it's collecting what we call social determinants of health. Social determinants of health is what shapes our health here, and that comes from potentially transportation, where we live, our education, our economic stability. So it's questions that are asked surrounding what we call the social determinants of health.
Okay, and real quick while we have you, the CDC's latest map updated January 1st, it shows Ohio in the high level of upper respiratory illnesses like RSV, flu, COVID. What's the activity level looking like in Mahoning Valley area? And then what can we all do to lower our risk of getting sick?
Yeah, so we are in cold and flu season. So some of the things, what I say is definitely go back to the basics. And those basics are, if you're sick, stay home. Make sure you're practicing good hygiene. Washing your hands. If you're going to cough into your sleeve or cough into a tissue. Get vaccinated if you haven't been vaccinated. So those are some of the basics that you could do to protect yourself. But we are in that cold and flu season. And one thing to bring up too is we do continue to still have our COVID test kits here at the health department. They're right at our front door. So if a community comes in, they can go ahead and grab one, and you can go ahead and test at home. And then you would know if you have potentially COVID, and you could stay home for the 24 to 48 hours that you are infectious.
All right. Thank you so much for joining us. Great tips as always, and we'll watch for that survey and the results that come out soon. Thank you for being here.
Thank you for having us. I appreciate it.